Most people put lavender oil in one of two buckets. Either it's a wellness cliche that belongs next to crystal healing and moon water, or it's something their nan swears by but couldn't explain. Here's what neither camp knows. The primary active compound in lavender, linalool, enters your bloodstream through inhalation and modulates inhibitory receptor systems in your brain, including GABA A receptors. It also acts on serotonin transporters and NMDA receptors, multiple pathways all pointing toward reduced neurological arousal. This isn't aromatherapy woo, this is pharmacology, and the clinical trial data is more compelling than most people realize. When you inhale lavender oil, linalool and linalool acetate are absorbed through the olfactory epithelium and the lungs directly into circulation. From there, they act on the limbic system, specifically modulating GABA A receptors, which reduce neuronal excitability and promote the calm parasympathetic state your body needs to transition into sleep. This is why the effect isn't purely placebo. The smell alone isn't doing the work. The compounds are doing the work. The smell is just the delivery mechanism. There's also a secondary pathway worth knowing about. Lavender suppresses sympathetic nervous system activity, meaning it actively lowers your physiological arousal state. For those of you tracking HRV, this is relevant. Studies show lavender inhalation is associated with improved vagal tone, which is exactly the autonomic shift you want before bed. So what does the actual trial data show? A 2025 meta-analysis of 11 randomized controlled trials covering 628 adults found that lavender essential oil significantly improved sleep quality with a standardized mean difference of 0.56. For context, that's a clinically meaningful effect, not a marginal signal. A randomized controlled trial comparing lavender inhalation plus sleep hygiene versus sleep hygiene alone found that the lavender group showed significantly better sleep quality at both post-intervention and 2-week follow-up, including waking feeling more refreshed. The sleep hygiene only group improved too, but to a lesser degree. That's your additive effect right there. A 2024 single-blind RCT found lavender essential oil inhalation helped reduce depression and improve sleep quality. Relevant because anxiety and low mood are two of the most common drivers of poor sleep in an otherwise healthy population. And for older adults or their families, a 2024 meta-analysis found aromatherapy improved sleep quality in older adults, with lavender as the sole aroma showing the strongest effect. The evidence isn't perfect. Sample sizes are modest. Blinding is tricky when the intervention has a detectable smell, but the direction of the data is consistent across populations and settings. Here's what the research supports practically. Inhalation is the evidence-based route, not topical application, not ingestion. A diffuser running 30 minutes before bed or a few drops of 100% pure lavender essential oil on a cotton ball placed near your pillow. Pure matters. A lot of commercial lavender products are diluted with synthetic linalool or blended with other oils. The trials used 100% pure lavender essential oil. That's what you want on the label. Consistency also matters. The studies showing sustained effects ran interventions over multiple nights, not a single use. Think of it like any other sleep hygiene habit. It compounds. One caveat worth mentioning. A small number of case reports have linked lavender products to hormonal effects in prepubescent children. The evidence is limited and mostly concerns topical use, but it's worth noting if you have young kids in the house. As a nurse who has read the trials, lavender inhalation is one of the few complementary sleep interventions that has genuine mechanistic plausibility and consistent clinical signal behind it. It's not a replacement for good sleep hygiene or addressing the root cause of your insomnia, but as an additive tool, the data supports it. A diffuser, 30 minutes, pure lavender oil, That's it. The pharmacology does the rest. If you found this useful, subscribe. Every week I'm doing exactly this, taking the health topics that sit somewhere between mainstream medicine and wellness culture, reading the actual evidence and giving you a straight answer.